Orthopaedics fracture both bones of forearm. Okay, mechanism of injury. A twisting force, usually fall on hand, produces a spiral fracture with both bones broken at different level. Radius usually at higher level. A direct blow or angulating force causes a transverse fracture of both bones at the same level. Treatment rationale. A fracture of shaft of radius at the junction of upper and middle thirds proximal to pronator teres is therefore situated between two groups of muscles. The proximal fragment has only supinators inserted into it, and the distal fragment has only pronators, thus causing supinator of proximal fragment and pronation of distal fragment. Fractures of upper third of radius, therefore, should usually be immobilized with the hard and forearm supinated so that the distal fragment is rotated into the same axis as the proximal fragment. If the fracture is at or below the middle third distal to pronator teres of the bone, the proximal fragment has both supinator and pronator muscles attached to it. It is therefore takes up the mid position halfway between full supination and full pronation, and thus and this forearm fracture should usually be immobilized with the hand and forearm in the mid neutral position. Open reduction and internal fixation by plating for displaced diphaseal fractures in the adult are generally accepted as the best method of treatment, and in children they are managed by cast. Night stick fracture is isolated fracture of ulna caused by blow on ulna causing transverse fractures that is usually non-displaced or minimally displaced and can be managed by cast. Displaced fractures are usually treated with compressing plate. Some points. Fracture of proximal forearm cast position is supinated position. Fracture of both bone forearm at same level position of the arm in plaster is mid-prone. In children and sometimes also in adults, it is worthwhile first to attempt manipulative reduction under anesthesia. If this is successful, a full-length arm plaster is applied with elbow at a right angle and the forearm in a position midway between pronation and supination, mid-prone position. The treatment of choice of fracture of radius and ulna in an adult is reduction and stabilization with plating.